Assalamu alaikum. My name is Saquib Rahim, and I'm an internal medicine doctor working on the front lines of the coronavirus pandemic here in New York City. I was asked by the American health professionals to give a brief video about that experience, and so the first question they asked me to answer was, "How's your day different now than pre-pandemic days?" Um, they're night and day. They're not even close. In the sense of obviously the pandemic has ravaged New York and we've been on shutdown. I worked 36 straight days in the hospital um, since the first coronavirus patient that came into the hospital where I work in Queens. And in some ways, it's almost become a routine now in terms of how we take care of those patients. But um, it's pretty much my life now is strictly going to the hospital, seeing patients, talking to my colleagues, then coming home and eating and going to sleep, and that's it. um, it's very monotonous, and like many of you, I miss normalcy, but it's necessary, and I'm grateful that at least we've started to see a flattening of the curve here in New York, and hope we can keep it that way. I think what is the second question they asked me was what has been the most difficult part about being on the front lines, um, and I think that answer is pretty obvious, and that's just the sheer level of death. Um, there was a stretch for about 2 weeks or so where I would say I had at least one patient die every day. Um, the most I had die in one day was five, and it was incredibly difficult to to just go through that, to have to speak to family, in many cases to be the last face that um, that this patient would see, and for that face to be a stranger. And that's I know lots of other parts of the country maybe haven't seen the incidents that we've seen in New York, but that's an experience I'm probably never going to forget, and it's not a pleasant one. And the third question they asked was any personal story that you'd like to share with the public that highlights the impact of this pandemic. The one that really sticks out to me um, was there was a patient, an elderly man who ultimately I had to intubate after several days of being on non-rebreather. And I called his daughter, who was a physician, just to let her know. And she just completely broke down and just started bawling on the phone. And then, choking back tears, she asked me or pleaded with me, "Can you please go into the room and whisper in his ear that she loves him, because these might be the last words he ever hears?" And I did that, but it was so tragic to me that that I had to impart such significant words between two loved ones, and that's one story that has just really stuck with me. Um, and the reason I think it's important is it reminds us all that there's lots of things we don't say, um, often for no good reason, um, and even to our own detriment. And so, my takeaway was that we really should be more transparent and vulnerable with the people in our lives, because you just never know when something could change and you lose that opportunity, or you miss out on that chance. And then the fourth question they asked me was, what motivates you to go into work every day despite the risks involved? And for me, what I would say is this is what we signed up for. It's part of um, the code of being a doctor is you don't go just when it's convenient. And obviously, those who are elderly or predisposed or at risk, um, it is smarter if they don't. But given I'm fortunate to be younger and healthy, um, I looked at it as this is our duty as physicians, but it's also our duty as Muslims, um, to try to be courageous. I don't want in times of adversity, and I don't want to oversell um, or hyperbolize my own contribution because I'm just one small entity um, that has just been trying to do the best work that I can. But there are so many of us, from physicians to nurses to NPs to PAs to support staff to um, to people who are working in transport, to the person who cleans, um, and I'm sure I'm leaving out tons of people, but it really um, everything that those people do is so important, and inshallah we'll never see a time like this again, but if we do, we need to be prepared. um, and so for me it was never a question of whether I would go in, um, and I hope that I was able to make some small impact. And then the last question they asked me to answer was, what message do you have for other Muslim health professionals who are also on the front lines? Um, First, I tip my hat to you. Um, if you've seen anything similar to what I've seen, um, we're all going to be changed by it. And I am so grateful for the work that you've done. Uh, and that's personally, but I'm speaking on behalf of society. The work you do matters, and um, and my other message would be, um, to continue to work on behalf of our patients, um, to keep yourself safe, to take care of your loved ones, um, uh, and let's try to make our work about improving society, because it's not only what's necessary, but it's what our faith would ask of us. And so, sending out much love and lots of du'as for um, anyone else who's who's battling on the front lines, and also to any of you who have unfortunately lost someone. Um, it really is tragic how many people um, this has impacted, and will continue to impact and could impact in the future, as well um, as the number of people that I even personally know, who've in some way um, been harmed by this pandemic. So, sending lots of love and du'as. Please keep up the good work, and inshallah, I hope to meet many of you down the line. And so, with that, I will bid you guys adieu, and early Ramadan Mubarak, and talk more soon. Take care. Assalamu alaikum.